Meanwhile, some pretty interesting developments in a struggle that has been happening regionally and certainly here in Calhoun County, and some good news therein. Joining us today is Mark Crawford from Bronson, of course, and Vice President of Community Health. Good morning, Mark.
Morning, Richard.
And also here today is Jill Wise of the Grace Health OB program. Good morning.
Good morning.
Thank you for coming today. Let's talk about infant mortality just as a subject for a second. What does that mean, infant mortality?
Infant mortality is the death of a live-born infant at any point prior to its first birthday. Okay. Been a challenge in Calhoun County for as long as I've been here anyway, and I'm sure as long as Jill's been here as well.
Well, and you know, I've been in Southwest Michigan since '97, and I've been hearing about these challenges here and in other counties as well. What gives? What's the nature of this problem?
Well, really, the issue, it's very complex. There are a lot of infants in Calhoun County dying before their first birthday. The rate has, for a long time, been worse than the state rate, meaning that there are a lot of counties that do a better job around infant mortality than Calhoun County does. So as a community, we have basically come together and done a lot of collaborative work around the issue, very specifically looking at the causes and factors associated with infant deaths and very strategically addressing those very issues.
And we want to talk about that, some of the initiatives that have taken place that now make us feel a little better about this. But what's at the root cause of this, Mark?
I'm not sure I could tell you what's at the root cause. I can tell you that we've discovered over time that all of these things are interconnected. So if you looked at Calhoun County's statistics, there are both health statistics and non-health statistics that impact health measures. And so if you looked at our average income, it would be well below the state average. If you looked at our average educational attainment, well below the state average. If you looked at teen pregnancy, well above the state average. And so you see a lot of things that sort of play together in leading to a high infant death rate.
And we presume that in those cases, then, as those factors begin to influence it, you have a decision to make about do you attack all of these at once, or one of them, or two of them? This is not easy decision-making, is it?
No, it's not. One of the things that we've done as a community is we've put together a FEMUR team, which is our Fetal Infant Mortality Review Team. And that group comes together and they look at the very specific situations in each infant death in our community. And we're able to identify, again, the causes and factors of those deaths. So we're able to strategize very specifically about the very issues that are pertinent and leading to the infant deaths in our community. One of the reasons we're here is because we have, for the first time, we're starting to see a trend downwards in infant mortality for Calhoun County. So that's very good news for us.
And we'll talk about why that might be coming up in just a minute on WBCK. We're talking today about some rays of light we've begun to see in an effort that has been somewhat vexing for some time. That is to say, the infant mortality rate in Calhoun County. Mark Crawford is here from Bronson and Jill Wise from Grace Health. So as a result of this collaboration that you've put together that has tried to study the causes, attack some of these causes, we're starting to see some progress here.
Yep.
Yeah, if we went back to about 2000, which is when this work really formally began, what you would see is a state rate that generally was around 8 deaths per 1,000 live births, and a local rate that would usually be a couple of points higher than that. By the time you got to 2007, work had begun, but we were literally double the state rate at that point.
Oh, my.
Really in-depth work, I would say, and I think home visiting has been a key here, and Jill can talk more about that. But the last 3 years, which would be 12, 13, and 14, I think are our last 3 reportable years, we've actually driven Calhoun County's rate below the state rate now. So we've gone from a historic rate of 2+ points higher than the state rate to one now where we're below and down at about 6 deaths per 1,000 live births now.
So it seems as you have recognized what some of these factors are and developed a plan to attack it, suddenly there's some tremendous progress.
Yeah, really, it's taken a long time, and the progress has been very gradual. We've seen the trend. This is about the third year in a row where we've seen the numbers a little bit lower. So we're going to start statistically seeing that rate a little bit lower than the state. A lot of what we have done has been really around surrounding pregnant women with information that they need to be healthy and resources that help them to be healthier. So, for example, our FEMUR team found in 2006 that 25% of our infant deaths were due to unsafe sleep environments. Babies were suffocating in their sleep. And so we did a lot of work around, again, education and resources. We provided a consistent message about what a safe sleep environment is, and we gave that in many, many venues. And we also provided a pack and play program, which provided parents and families with a safe place for baby to sleep if they didn't have one. So really, I see a lot of what we've done really wrapped around providing the education and the resources. So, like I said, the Infant Safe Sleep is one of those things that we've done. Another example that Mark brought up is the home visiting services. So we do have a lot of programs in the community that allow nurses or social workers to go into the homes of pregnant women or families with infants and talk to them very specifically about the issues that they are dealing with. And they're not always health issues. Sometimes they're social or economic. So we're walking them through, being sure they have a safe home, that they're getting the education that they need, that basically we're really encouraging them and supporting them throughout their entire efforts to be pregnant or parenting.
Well, it's understandable that some of these things are social issues that get in the way, but it really is interesting to hear you talk about, for example, the safe sleep thing that, you know, it's kind of interesting because as I get older, I look at some areas of the world and realize, oh, people don't know X or Y, and you just presume that people learn these things, but sometimes these are basic things that people just don't know.
Yeah. There's also mixed messages. You know, different people promote different things. So what is a safe sleep environment is debatable.
Right.
So what we have done as a community is we have agreed on what the safest environment is, and we have all agreed to give the same consistent message. So a lot of our work, not just around infant safe sleep, but about healthy pregnancy, healthy preconception, all of those things is really a lot around being sure that every touch point where a woman goes, whether it's her OB provider, her home visitor, whether it's the WIC office or whatever health and human service agency she's getting from, that we're all giving the consistent message.
So, Mark, how does Bronson fit into this, and what's the role that you have?
Well, I don't know if I will talk specifically about Bronson, but I will say that I loved the fact that you used the word collaborative, because really that is what has made the RHA's work and the work specifically around fetal and infant mortality go, is that it is a very collaborative environment. So at Bronson Battle Creek, as an example, Grace Health is a part of every delivery. And at Bronson Battle Creek, we help support the Nurse Family Partnership, which is a one-on-one program operated by the health department. And there are a number of other organizations in the community who all play a part in the education and the alleviation, in the support around these often young mothers who don't have great role models in advance and who need help to understand how to deliver and how to care for a new young life.
And if you are someone who is close to someone who's a new mother, a person similar to the description that Mark just gave, there might be a way you can help too, and we'll talk about that coming up. Today, we're talking with Mark Crawford and Jill Wise. They are at the center of an effort to help reduce the infant mortality rate in Calhoun County, and there has been some success after having been double the state rate at one point, which is just incredible to contemplate. Let me ask this before we talk about a couple of other things. How do you identify the persons to whom you should direct your attention in this effort?
Well, at Grace Health, our approach really is any pregnant women at all should be addressed. We assess every woman the exact same way. They're all going to have different vulnerabilities, and we try to identify them, and we try to address their very specific risks. So no one's, everyone's at risk in some way. It's really an issue of where is there a lack of education, where is there a lack of access, where is it that they need some more support. All women need some support of some kind. It's just pointing them in the right direction.
Yeah, and we certainly have alluded to the socioeconomic factors and social factors, but anybody might be at a point where they don't know what safe sleep is.
Yep,
so
exactly.
That could mean anybody. So there is a way in which you go about this education, right? As maybe for lack of a better term, a standardized way you approach this. Is that true?
Yeah. One of the things that we've implemented over the last couple of years is ensuring that all pregnant women are getting the same information through Baby Basics. Baby Basics is a book. It's a month-by-month guide for pregnant women that talks them through what's happening to their body and what impact they can have to be healthier. So it kind of walks them through some decisions that they can make to have a healthier pregnancy and therefore a healthier birth outcome. That book is being distributed by all OB providers in Calhoun County, and it's being referenced by any social service agency or health agency that they get connected to. So we're all referencing it.
There's a little joke out there about a child not coming with an owner's manual. This comes kind of close to that.
Yeah, it comes close.
and a website that goes along with it. The Born
Okay.
to Be Healthy website where you can find a lot of the same information and great access to tools.
So, yes, a woman who's expecting then can, especially obviously if she hasn't been expecting before, might not be completely familiar with what to expect.
Exactly.
Yeah, this is interesting. So, what is the Regional Health Alliance then? You talked about your FEMUR team. Now, how does that fit into the Regional Health Alliance?
Sure. Regional Health Alliance is really a county-wide collaborative, hundreds of members now, been around for about 15 years.
Okay.
It is housed at the Battle Creek Community Foundation, and it helps the county focus on health metrics that need a little bit of work. So we have issue action groups, and the Maternal and Infant Health Commission is one of those issue action groups. You've heard, I think we've been here before to talk about our community health needs assessment.
Right.
That needs assessment is another one of the pieces that helps identify those things that we want to work on in Calhoun County. And then the issue action groups like Maternal and Infant Health Commission, Access to Care, 5Cs, the Cancer Control Coalition, all kind of lead the work then on specific measures.
Mm-hmm. Somebody's listening to this now who maybe they're a grandmother or an aunt, as they say in New England. When I said aunt with my Michigan accent, they just looked at me strangely. An aunt who is around, or an uncle or a brother or somebody who might have influence over a young mother, and they are wondering, how do I help? How do I fit into this? Is there an answer that you usually give folks to that?
Yeah, I would say that really the answer is to get informed. Know what our messaging is, know how their health decisions impact pregnancy. They can learn about Calhoun County's resources, getting people connected to resources by going to borntobehealthy.com or .org. And if they could do that and point these women in the right direction, we really believe that if women can hear a consistent message at least 7 times throughout pregnancy, they're more likely to retain the information, they're more likely to change habits, and therefore have an impact on their health and the health of their baby.
Boy, in advertising, we used to say 3 times. 7 times they need to hear that, huh?
You're talking about changing habits.
Yes, it's different, right. All right. Is there an expectation then, based on the encouragement of these numbers, that this trend can continue?
Boy, absolutely. Again, we have some really exciting things going on right now. These are very hard numbers to move, and to have moved them successfully over the last decade, to finding ourselves at a place where we have back-to-back-to-back numbers now below the state rate, to know that we have Bronson and Grace Health and the Health Department and Summit Point and Oak Lawn Hospital and partners across the county working together. I think we all expect that we're going to see this momentum continue.
Well, that sounds like a good place on which to leave it. Thank you again for bringing this to our attention, and we'll stay in touch on that.
Thank you, Richard.
Thank you.
Right. 8:20.